Guys, welcome back. This video is going to be different. It's not scripted like in this perfect way, but it's more of a personal check-in. Before we start the upcoming series, I think it's important. I wanted to pause and just talk to you, nurse to nurse. It's not about having this motivational quote or feeling like I'm a productivity coach. That's not what this is. Um, and it's not going to be me just telling you that you just need to practice self-care. If you're watching this and you've been feeling heavy and tired, feeling just numb and emotional, or you just honestly just haven't been feeling like yourself, I want you to know that this is a safe space and you're safe here. And I want to be clear from the very beginning in reminding you that you're not weak, you're not dramatic, and you're not failing at nursing. You might just be carrying more than anyone was built to carry for this long. I've been thinking a lot lately about us as nurses and how we're expected to show up no matter what's happening in our lives, no matter what's happening in the world, even regardless of what our bodies feel, no matter what our mind is thinking, we're expected to show up. So we show up when we're exhausted, we show up when we're grieving, we show up when we don't necessarily feel supported, and we even continue to show up when we're running on empty. And I've realized that a lot of nurses are walking around with this invisible weight. And because we're nurses, we call it normal. We see it as part of the job and we say, oh, well, it's okay. I'm fine. I'm all right. But I don't want us to live in that space. It's okay to occupy that space briefly, but it shouldn't be a space that we live in. So this series that's coming, it's for the nurses who've been holding it together for everyone else and find that you're slowly losing yourself in the process. When you think about what holding it together looks like, sometimes it's not even about crying or about breaking down. It's sometimes just realizing that you don't necessarily have words to express how you feel. It's about being in a crowd, being surrounded by people, but you still feel alone. you know, um, Hearing the phone ring or hearing someone get ready to ask you something and you're already irritated. Like you have to prepare yourself to be kind or to be nice when that just isn't the space you're in. And you know what? The crazy thing is, you still might be a great nurse. You might still be showing up and you're still taking care of people. You're being professional. So no one really notices how you're feeling and what that looks like. And sometimes you don't even notice yourself until one day you'll look up and say, where did I go? Where is the part of me who loved this? Like, I don't even see myself anymore. And that's one of the reasons why I wanted to create this series is because nurses don't always talk about the hidden cost. We don't talk about how being constantly needed changes our nervous system and how the fact that we're constantly witnessing suffering, how it changes how we ourselves see the world. And always being responsible changes the way we even relax. We don't even relax the same when we're constantly responsible for the well being of others. So we don't talk about the emotional carryover and what we end up holding on to well after we leave our shift, well after we give report and we've clocked out for the day. We don't always talk about that. The way that the shift and what happens at work, you carry that home. You could still be in your bed after working a shift and still thinking about and feeling like you're still on the unit. And if you've ever felt that, I need you to really hear this. It's not a character flaw of yours, it's what your body and your mind has been responding to in order to sustain and carry the weight of that stress. So I think that many nurses don't understand or realize the difference between being fine and coping. Being fine is saying, I feel like myself. I have capacity. I can breathe. With coping, it's just that you're functional. You're just functioning, but you are in a fragile state. Any, if something comes along large enough or requiring the mental bandwidth that you may not have at this time, it could totally knock you off your game. So, coping is you're getting through the week. You're counting down your days until you have your day off. You're going to sleep, but you wake up and you're not rested. You're eating just for the sake of eating. You're laughing, but you're not really enjoying life and what that looks like. And some of us have been coping for so long that we don't remember what being fine really feels like. So if this is you, I'm not here to diagnose you. I'm here to just give you language to what you might already be living because it's key. In being able to do that, we're able to share with other nurses what that looks like. And more importantly, how to get past that. So I'm going to ask you something. And again, remember, this is and always will be a safe space and a safe place. So you can answer this question in your head. You could put it in the comments. Remember, I want this to always be a dialogue. But what has changed since you started nursing? Not the skills, not the knowledge, but you. Have you become more anxious, more guarded, less patient? Do you find yourself being more exhausted? You just feeling disconnected, more sensitive to things? Or maybe you just feel totally numb. After you ask yourself that, ask yourself this: have I been judging myself for changes that were actually survival? Like, was I already in survival mode? Because sometimes the version of you that feels different is really a version of you that had to adapt to your current situation and your current environment. And adapting is not always healing. So you have to think about that and think about this guilt that we have as well. We carry guilt in so many different directions. We feel and carry guilt for not doing more. We carry guilt because we need rest. We carry guilt because we're being frustrated. We feel guilty for not feeling the same passion we once had about this profession. Feel guilty about wanting to leave the bedside because you know that you feel that you need to do this for you, but you feel guilty because you know there are people who really need you. And you feel like it's hard for you to make this choice. And I want to tell you something that I don't hear enough people say. Guilt is one of the biggest sources of nurse burnout. It's what fuels nurse burnout because guilt will keep you over giving. Guilt will keep you over explaining. Like your no should just be your no. When you feel guilty, you feel you have to explain more. You have to get people to understand where you're coming from. It keeps you saying yes when your body is literally begging you to say no. So, in this series, we're going to talk about guilt, not as a personality trait, but as something we've been trained to do. So, here's what you can expect from this upcoming series. We're going to talk honestly about nursing burnout without shaming nurses. Remember, we're not here to shame each other. We're here to make sure that we're better. When this is all said and done, we want to be on the other side of this better so that we can pull other nurses to the place where they're better as well. So we're going to name some things that we've normalized. We've normalized short staffing, missing breaks, being emotionally overloaded, toxic workplace dynamics. Okay, the pressure to be perfect, the expectation that you are to be strong all the time. And then we're going to really do something that is so important. We're going to talk about what helps. Again, getting us to the other side. And we're not going to do it in a shallow way, but in a real way. We're going to take a look at what boundaries look like, how we take care of our nervous system, how we rebuild support, learning how to decompress, learning how to stop living in survival mode, how to be compassionate without feeling like you're abandoning yourself. And remember, the goal isn't to turn you into a different person, it's to help you come back to yourself, it's to redirect you back to yourself. So, I also want this to be a series where nurses talk to nurses. So, if you're willing, I want you to comment, uh, you know, whether you feel numb, I feel tired, I feel guilty, I feel stuck. You could even feel hopeful, or it could be the place where you don't know what to feel. And if you don't want to share it publicly, that's okay too. But I want us to be comfortable with each other and the emotions that we're carrying and what we're feeling. So even if you just sit with that truth, it's still you moving forward. So I'm so glad you're here. So glad you're here. And if you've been trying to carry everything alone, let this be your reminder. You were never meant to carry things by yourself. And I invite you to subscribe if you want to walk through this series with me. All right. And I will see you in the next video. So until next time, friend, be well, take care of yourself, and stay safe.